Hi, everybody. This is Dr. Nam Lee from Lee Acupuncture. Today, I have a special guest and Dr. Angela Potter. Hi, Doc.
Hello.
Hi. So let me introduce who she is. I mean, she's amazing. You guys really should be excited. So Dr. Potter, she's a naturopathic physician, and she graduated from the Bastyr University with a Bachelor's of Science in Nutrition and went to school called the NUNM, it's National University of Natural Medicine, which is the oldest naturopathic program in North America. And she got her naturopathic medicine. And also she's a holistic pelvic care certified the practitioner from the Tammy Kent. Actually, I have her book, Wild Feminine,
That's a
phenomenal.
great one.
Okay. So the reason I want to hear and then invite Dr. Potter, as you know, our clinic is specialized in infertility and then fertility. The do this great support from IVF doctor or our community patient and our excellent acupuncturist doctor in our clinic. So we actually have a lot of patients got pregnant, like wonderful. The number and the percentage of conception is actually goes every month higher. So question here. Okay, you get pregnant. Is that your final goal? Our patient always at the first visit, okay, what is your goal? What's the purpose of a visit? And they said, getting pregnant. But I always correct a little bit. Your goal is supposed to be have a healthy baby and then happy family. So as soon as our patient got pregnant, now we are going to the next chapter about wellness or support for patients with this prenatal and then postpartum care, and which is Dr. Potter's specialty, I believe. So, Dr. Potter, can you tell me a little bit about your practice?
Yes, absolutely. So, you know how many new moms have trouble with mood swings, anxiety, and struggling to heal physically after birth? They're frustrated, how they feel overwhelmed with all these pressures of being a mother, and the relationship with their partner is strained. So
Mm.
I help them have a balanced mood and feel empowered with their health so that they don't have to continue feeling like they're doing this alone. And instead, they can focus on the magic of this time with their baby.
Oh,
And my office is here in Portland, Oregon, but I see patients virtually from all over the country.
excellent support for this time of the pandemic. So,
Yes.
what made you focus on this pregnancy and then postpartum part?
Yes, so I am a mom myself. I have two kids. They are 2 and 4. And it was after the birth of my son, my 4-year-old, when I became passionate about it because, during his pregnancy, when I was pregnant with him, I didn't really plan for the postpartum time. I didn't expect that it would be difficult or anything that I would need to plan for, right? No one had really mentioned that it could be difficult.
Fortunately.
Yes. And so then, I gave birth to him. A couple things happened in that birth. I got a tear, and then also him and I had to be separated for a little while. And that both of those things really set me up for a very difficult postpartum healing. And, I remember this one moment really clearly. It was about a month after giving birth, and I was laying in bed, and I was in a lot of pain, and so that's basically the only place I could be. And my husband comes into the room, and he picks up our son, and they have this really sweet moment together. And I remember this so clearly, and watching them, and of course, like as a mother and the wife to my husband, like I really loved this moment and watching them. But at the same time, I felt so confused, and I had thoughts going through my head like, well, why can't I be enjoying this time with my baby and having this like very direct connection with him? Is something wrong with my body? Is something wrong with me? Should I even be a mother? And all I could think about was, well, I need to figure out how to get more sleep figure out how to eat
Mhm.
and how to get out of this pain. And, this was about a month after giving birth. And that continued. And in that moment, I knew that number one, there's no way that this was like how postpartum healing was supposed to be. And I knew that there were so many more things that I could be researching and finding to help support my body. And then I also knew that in my journey as a doctor, that I would be here to be helping other mothers and to either help them prevent this or, come alongside them when they are struggling like I was feeling, to help them to get to this place of strength and feeling empowered and validated on this journey.
You went through already, and then you tried to help them. Such a lovely story.
Thank
So
you.
when people, like, let's say when they hear about the postpartum, a lot of people think that this is more just emotional, like a challenge, as you said, going through all this difficult time, and then motherhood, like, especially for new mom. But or like a medicine side, I'm always looking at is a more biochemical side, like a hormone reaction. What's your opinion about, is it postpartum is more emotional kind of close with the crisis, or is it more biochemical crisis?
Yeah, so actually, it's a mix of both.
Mm.
This is such a powerful time in a woman's life. And, becoming a new mother, regardless of if it's your first baby or your fifth, every postpartum time, it can be very different.
Mhm.
And so, in those first 2 weeks, we know of as the baby blues period, right? It's highly emotional for women, lots of ups and downs. And that has to do with our hormones. Our hormones really crash directly after giving birth. And so, those hormones, like trying to balance, that is causing those mood swings. And for so many women, that is continuing after those 2 weeks.
Mm.
And it's really because we don't have the support system set up in our culture to provide this extra support and resources for the mother, so these women are left feeling like they're alone and wondering, like I had been, like, well, what's wrong with my body? I see these pictures of these women out there, or celebrity photos, like those women seem to be doing fine. Like, why is my body not doing this? Why am I still having anxiety? Why am I still having these body pains? And that has, we have all this extra stress in our culture of the pressures to get your body back, pressures to be like the perfect ideal mother,
Mhm.
and that adds so much stress. And so at that point, yeah, we do need to look at the biochemical picture. Like, what are your
Mm.
hormones doing? Do you have some nutrient deficiencies from birth? Anemia is really common in birth. We lose so many fluids and blood, and it's not actually a standard of care to be checking women for anemia. And so it's really important to seek out somebody who will help you get these tests done, so that you can understand, is there a root, what is the root cause of how I'm feeling right now?
Excellent point. Excellent point, actually. So you seeing so many patients over the years. What you seeing as like a biggest struggle many patients experience in this, like a pregnancy and then postpartum?
Yes. So I see two things most
Mm.
often. One is going to be that emotional, that mental component. So
Mhm.
the overwhelm, anxiety, depression. I see a lot of women who are coming in for their second or third babies during pregnancy, because they want to prevent having a really difficult postpartum period, right? They're like really anxious about going through a very difficult healing process again. So that's what a lot of things that I see during pregnancy. And then in that postpartum time, it's overwhelm, it's burnout, it's, really struggling with that um, idea of what you expected motherhood to be like versus what it actually is. And for a lot of women, that's that, the anxiety, the mood swings, the irritability, which then leads to this deeper sense of like guilt and shame to be
Mm.
feeling that, because you think like, well, I should be enjoying this time with my baby. Why am I not? And so that really sits very deeply for many women. And then also there's that physical component in that healing as well as they expected to after birth. So struggling with pelvic pain at birth and not understanding.
I guess we had a little bit of connection issues, but I think that's
Yeah,
fine.
I think there you are. Okay.
Uh-huh. Okay. So let me ask you another question. Since we are the treating patients with the pregnancy and then postpartum or prenatal, I'm always seeing this hormone part, especially thyroid hormone, plays a huge role in this some health challenges our women's going through. How about do you see any let's say some the help for or changes with this specific hormone during the pregnancy and then postpartum?
Yes, absolutely. So, even women who are trying to get pregnant, right? You want to get your thyroid levels checked because the thyroid really interacts with our ovaries. They talk to each other, these hormones. And so, getting those hormones checked actually before even conception. And then pregnancy, we always want to check it because it's important to help the development of the baby. And then postpartum, but 5 to 10% of women get postpartum thyroiditis within that first year. Now, first
Mm.
off, postpartum thyroiditis means an inflammation of the thyroid gland. So it could come up as low functioning thyroid or elevated functioning thyroid. And, the symptoms for that are anxiety, weight gain, or inability to lose weight, fatigue, insomnia, things like that, that women are already experiencing so frequently postpartum. So it's important to get those thyroid hormones checked. And particularly looking at your thyroid antibodies to see if
Mhm.
an autoimmune condition came up, that is common. And like I said, it's estimated that 5 to 10% of women get this postpartum thyroiditis. But that is actually a low number because we are not testing women. There is no standard of care to test for blood work in the postpartum time. So
Mm.
many, many women are struggling with this, and we just don't know because their hormones haven't gotten checked yet. And for women who are struggling with this, there are lots of different ways to support the thyroid so that you can get it back to balance. I recently was working with a patient. She had elevated thyroid antibodies.
Mhm.
She came in to see me at about 8 months postpartum. And we have gotten her antibodies to below the threshold, and her thyroid hormones are in normal level. So it's definitely a possibility.
Wow. So she's been suffering for 8 months so far then after. That's a long
Yes,
time. Long
right.
time for new mom. I'm glad actually you can help her. That's wonderful. I know you are really supportive doctor in my view. Like you are just your personality yourself. But you also have a Facebook support group for the patients with this. Can you explain what exactly it is?
Yes. So I have a Facebook group. It's called Pregnancy and Postpartum Wellness,
Mhm.
and it's a free group. I invite any women who are looking to become pregnant or who are already mothers to come join. And it's just a community to get some tips and resources from myself to, feel this community with other mothers around, and to a place where you can seek out resources as well.
Wow. So you're involved in it. If they have any question, they can still done from your directly through the support group then.
Mhm, mhm.
Wow,
Yes,
that's
I mean, I can't offer any like medical information
no,
or
no,
anything.
no, no, no.
It's a lot of, yeah, a lot of resources and support.
So
Yes.
the name again, one more time, your support group, pregnancy and postpartum
Pregnancy and postpartum wellness.
wellness. That's lovely.
Mhm.
So the one thing I was checking because I'm a traditional Oriental medicine practitioner,
Mhm.
but I'm actually Korean. We use a lot of vaginal steam. That's kind of a unique concept, but I grew up with that one, and I saw you have a special blend. And can you tell me a little bit on what it's for?
Yes, absolutely. I'm so happy that you brought this up and that you're familiar with it because definitely here in the States, it's still like not super well known. But it's very much gaining some ground. And
Uh-huh.
yes, so again, after the birth of my first, and I struggled so much with that postpartum time, then I became pregnant with my second baby. Because I did, I got to this point where I felt really strong, very healthy, and so I got pregnant with my second. But during that pregnancy, I was determined to, research and put together a postpartum healing plan for my body, so then I wouldn't feel as terrible as my body felt after my
Mhm.
first, right? And so enter vaginal steaming. This is when I found out about vaginal steaming. It's also called V steaming, yoni steaming.
Uh-huh.
And so I started making an herb blend. The herb blend that I use, I now sell it as well. It's herbs specific to the postpartum woman. A lot of herbs that I actually recommend that women take internally through teas. Nettle is a fantastic herb for a mom healing after birth, and so that's in there. And then also herbs to support like tissue healing, comfrey, calendula, um, things like that. And so basically, vaginal steaming, if you're unfamiliar with it, it's where you steep herbs in water, just like you would a tea. But then you put the pot of water on the ground or underneath a chair, and then you sit over it and let it steam. And it's very powerful for the
Oh,
postpartum time. Yes, for, all those tissues that are healing, the steam, the pressure of the steam can help to put organs back into place, help prevent prolapse, which is very common in the postpartum time. And it's very relaxing. I actually steamed every day for 30 days after my second baby's birth, and it was my favorite part of that healing plan. And it felt so nourishing and rich to my body. I know a lot of people are skeptical about steaming. They're very unsure. If you read articles that are, speak out against steaming, typically you're hearing one of two things. One is that, you can get burns from it. Well, if you drink a hot cup of coffee or you spill a hot cup of coffee on your skin, you can get burned from it. So of course you do not want to be sitting over the steam when it's hot and you feel like it
mhm.
could burn you, right? It should be very relaxing, like going to a sauna. And then number two is that people are very apprehensive about using herbs. And myself, I'm an herbalist,
Mhm.
and you do need to be knowledgeable about what herbs to use. Some herbs will cause more bleeding. That's something that's very important to watch out for with the vaginal steaming. So you just have to work with somebody who understands how to use herbs and understands the mechanisms of the herbs and how they are supporting your body during the vaginal steam.
Lovely, lovely. We actually use a lot of mugwort
Okay.
in the Asia. They use a lot of mugwort, and even before like try to get pregnant and then having your womb gets warmed up is through the mugwort, and then after that as well, then we heavily use, and then all fine. So don't worry, it's very safe. So thank you so much for all this wonderful tip, and I really appreciate it. I know you're a really busy doctor, so can you tell us how the last question here? What can be done to help to figure it out, and then how people can find you?
Yes, absolutely. So, for those of you watching who are, you're planning to give birth soon, or you're in that space where you are feeling like you're in zombie mode and your baby is 3 months old and you're thinking, I thought pregnancy was the hardest part, right? Like you need more support
Mm.
and you need a guide to help you navigate this time, to help you get the lab testing that you need, to help you with nourishment and how to set up a support system for your body. This is exactly what I do with my patients. And because you are here in Dr. Lee's community, I want to support you. And so I am offering 5 free phone consults with me where we can talk about your most frustrating health issues since giving birth, and then talk about some key steps that you can take to start feeling empowered and strong and healthy. So I'm open this up to you. And then even if you're watching this, weeks later or something, and you don't think that those spots are open anymore, reach out to me, tell me that you came from this interview, and I will be sure to take care of you. And you can find out more on my website. That's drangelapotter.com, drangelapotter.com. And I'm on Instagram and Facebook. You can find me just at Dr. Angela Potter.
Thank you so much for the offer. How wonderful is that? I'm sure everybody start calling me right now. Thank you again, Doc, for your wonderful tip, and thank you for being here for our community and then our practice as well.
Oh,
Appreciate it.
yes. Thank you so much, Dr. Lee. Thank you.
Thank you. Bye.
Bye.